even if you feel emotionally strong, you feel fit mentally and physically, and you embark on cosmetic surgery, you still can find the process overwhelming or stressful.
They come with a picture and say, I want to look like this. How do you manage that?
In medical school, every person who goes to medical school does learn some basic psychiatry.
Yes.
But by no means are they a psychiatrist.
It's like a buyer's remorse. Like, why did I do this? Because it is cosmetic. It is elective surgery.
Part of being human is you may have some psychology which may be very healthy, and some people bring some unhealthy psychology to the table. Hey everyone, it's Dr. Solomon. I want to welcome you back to our podcast, Unfiltered. Today we're going to be talking about mental health and preparedness for cosmetic surgery. And today Nancy's away, who's our usual co-host. So today, just like I guess Regis Philbin had, who did he have? He had Kathy Lee, and then he had Kelly.
Then he had Kelly.
He had Kelly after, so Kathy retired, and then he got Kelly. So I have my Kelly, I have Maya here today, filling in for Nancy, and she's doing a great job. And she's going to be asking me some questions regarding mental health preparedness. It's a huge topic, so we're just going to sort of get over the surface of it, but I think it's a great topic to discuss.
Thank you. Thank you for letting me sit on this velvet couch today with you.
For sure. You're welcome.
During the consultation process, I know that you obviously go through the physical part of a patient that needs to, come in for a facelift, a rhinoplasty, etc. But how do you get through the physical and mental part of it? Like, they are going through something emotionally and mentally as well when they come to you. So how do you get through that during a consultation or break through that during a consultation?
Yeah, so it's a very hard topic to broach because we meet people for relatively short periods of time when they're seeking cosmetic surgery. Many of the patients we've seen have done their own research. They have their heart set on a procedure. They almost come in ready to go. I wouldn't say everyone, but I'd say probably more than 70% are like that. And then part of our job is to slow the process down a little bit, sit back and make sure that we're all on the same page and that they feel comfortable with the procedure that's planned, and that I'm comfortable with the procedures planned, and that expectations are set, and that we all agree on that. But as you can imagine, it's easier said than done. So
when they come in with a picture, because you get this a lot too, they come with a picture and say, I want to look like this. How do you manage that?
Some of those are helpful in terms of giving us a sense of what patients desire, but a lot of them can be red flags. So a red flag could be something that a patient says that triggers something in our training that says this patient may not be happy with the surgical outcome, no matter how good a surgeon you are. And so having a picture of a celebrity, for instance, saying, I want to look like this person, or things along that vein may not be realistic.
Yes.
That being said, sometimes we see people come in with inspirational photos and they acknowledge that it's inspirational rather than that they have to look a certain way. And in terms of an inspiration, it can be helpful both for planning, but also it may set the stage as to the discussion about what's realistic and what's not. So if someone brings in a photo of a celebrity that they actually could potentially look like, then that's a different conversation than bringing in a picture of a celebrity that there's no way on earth, no matter what you do, they're going to look even remotely close to that. And so part of it's sort of teasing out the nuances of the actual situation. And then, again, setting expectations, because it could be a conversation starter. They want to look like X. Mm-hmm. And if you start telling them, look, I don't know if that's realistic because of X, Y, and Z, your skin type, your anatomy, your facial structure wouldn't work,
yeah, and
they're not happy with my response, then clearly at that point, it makes it almost easy to say, look, this is not a good idea. Let's backpedal and maybe not proceed with it. And that can sometimes be very tricky, because if a patient's already made up their mind that they want you to be their surgeon and you're not feeling that it's necessarily a good idea, how do you disentangle yourself from that in a way that they don't feel like they're being ignored, dismissed, or abandoned? So that's part of the hard part of the job.
It
is when
is.
you get into these circumstances.
And you touched upon it slightly, so I have a question. During your schooling, which wasn't that long ago, right?
No, not at all.
You've been doing this for over 20 years, but during your schooling, were you taught, like, is there something that you go through during your schooling, during your internships, your fellowships, or it's just by experience to kind of start looking at everybody and knowing whether to turn away a patient to, or how to determine those signs that maybe this is not a patient that I want to treat?
Yeah, and it's a great question because, like many things in medicine, you sort of learn it throughout your career. In medical school, every person who goes to medical school does learn some basic psychiatry.
Yes.
But by no means are they a psychiatrist. People who pursue careers in family practice often develop more of those skills and get more exposure to psychiatry than, I would say, people who go into the field of surgery or any surgical discipline or even internal medicine. But that being said, every single person that we're treating medically or surgically has their own unique psychology. And so being able to figure out, their physical state as well as having some sense of their mental state is very, very important for myself as well as the patient. But we don't necessarily get well trained in it in surgery. It's sort of touched on in cosmetic surgery more than other types of surgery because there's certainly more examples of where there's interplay between the two, such as body dysmorphia or distorted self-perception, mood disorders, anxiety, obsessive compulsive disorder. All of those things are probably more relevant in cosmetic surgery than if someone's getting their gallbladder out or things like that.
Yes.
But when I trained in Toronto, our program director at the time was somewhat of a worldly guy, and he recognized this, and he made all of the surgical trainees spend at least 1 to 2 months in psychiatry, which I found useful, and I sort of reflect back on it. But it just helped you sort of have a general sense of like things that people sort of bring to the table. But being in practice in aesthetic medicine, you almost like learn in practice and then enhance your knowledge of this by courses or communication with colleagues. So some of the biggest challenges that we deal with are dealing with OCD, anxiety, depression, and then personality disorders, which is another aspect of psychiatry. There's something called the DSM, which is basically a psychiatric compendium of diseases. And they break it down into different axes. From axis 1 may have things like schizophrenia or severe depression and things like that. And then the personality disorders are on a different axis. But many people have more than one axis diagnoses. And so you may say, well, wouldn't you want to avoid everyone with any diagnoses? Then we wouldn't be operating on anyone because most people bring to the table some mild version of just part of being human is that you may have some psychology which may be very healthy, and some people bring some unhealthy psychology to the table.
As well as insecurities, like you've grown up with, say, a crooked nose or a bigger nose or a nose with a bump. So that's their insecurity. So they're coming to you. So that's not necessarily any of these disorders or anything that's a mental state.
Yeah, exactly. So some of the things that we deal with on a day-to-day basis may not meet the criteria to be a mental state, but may still prove challenging when we're doing surgery and then going through the recovery. Plus, some things are fixed and some things are transient, and some things can be managed. Just like other physical states, you can manage it with medications or lifestyle changes. Psychiatry and psychology can be modified as well. So sometimes we will operate on people who are open about things like that. In fact, it's almost healthier if the patient acknowledges, look, I suffer from depression or I have anxiety. I'm on medication for it. I see a psychiatrist or my family physician's managing me. And then in those circumstances, it's almost like we're bringing all the information to the table. And then we may say to them, look, can you speak to your family physician or your psychiatrist just to make sure they think this is a reasonable thing to do in your current state? Because it's impossible for the surgeon, whether we're using our own sort of analysis, our own judgment, we can't always figure out exactly whether a person's in the perfect psychiatric state. Neither can a psychiatrist, but they may have spent more time with them to be able to really give us some feedback. So we do sort of sometimes ask patients to provide us with that.
Yes, yeah. And the intake form is actually very important as well when the patient comes in initially for their consultation. And some of those questions are on our intake form, as well as any medications that they are taking. So that gives you a good indication coming in as well. Where am I starting at, if they're on certain medications or if they've indicated depression, etc. So that's why it's so important for us to review it as well at the front desk, and for us to give you the like a highlighted so that you're aware of it as well.
Yeah, no, for sure. And sometimes we're surprised. Some patients may just gloss over and not even mention any of it.
Yeah,
But then
yeah.
you look at their medication list and it indicates they're on a bunch of things for, anxiety or
Whatever,
depression.
yeah.
And then you ask them about it and they're like, oh, yeah, but I'm totally fine,
Yeah.
which maybe they are totally fine, but at least should be brought into
into-
the conversation to make sure, because even if you feel emotionally strong, you feel fit mentally and physically, and you embark on cosmetic surgery, you still can find the process overwhelming or stressful. And we're trying our best to avoid situations where we trigger you to be in a depressed state. Because I have had cases
That's
where,
true. Very true.
like, we've
That's
had
really
situations where we've had patients who don't have any diagnoses, are not on any medication, have never seen a therapist or even discussed anything, and then they get into a deep sadness or depression, almost regret after a cosmetic
It's
procedure.
like a buyer's remorse. Like, why did I do this? Because it is cosmetic. It is elective surgery.
Right.
Yeah.
And so the buyer remorse thing most often is transient. So we sometimes have to hold their hand and like work our best, with them to reassure them that they're going to heal and change.
Yes.
And that, for instance, rhinoplasty in particular, things aren't going to look the exact same way now as they may be in 6 months. And frequently we've seen people where they have this moving psychology or emotional state following
Yeah.
surgery. And then you also have moving physical state because the nose is going through the healing
Yeah.
process. And we try to tell them, like, look, we need your psychology to be strong because we
Yes.
need to wait it out. And we
Yeah.
need you to be patient. That's the word no one wants to hear, patience.
Yes,
But
or
it's
realistic expectations. Like, I know when I go in to see rhinoplasty patients at the beginning of their consultations, I'll say to them, you'll have the splint on your nose for 1 week. You're going to come back and see Nurse Maddie to remove your splint. And it's not like the movies. You're not going to take it out and this sunshine is going to be bright and now everything is clear and you have this perfect nose. There's still going to be bruising. There's still going to be swelling. So it's managing those expectations. But how do you, if a patient comes in, say after a facelift is a longer process. So how does you manage someone that comes in that may be going through looking in the mirror and going, what did I just do? Kind of idea or thought, and manage them to not to worry or not to be patient with it.
many of our facelift patients are sort of middle-aged and sort of in a slightly different age bracket than some of the rhinoplasty patients can vary in age from
True.
16 to 70 or whatever. So it's a bigger range. And then the self-perception of a nose is changing your appearance, something you really didn't like your whole life potentially, and you're changing it. And then when they've changed it, they have to get used to their new look. They've done studies on this where they basically patients are just not used to the new look, regardless whether they like it or not. They look in the mirror and they're just not used to seeing themselves that way. So that can
taken, yeah.
yeah, so that can trigger all sorts of different emotional states. So again, there's time of recovery, there's the physical recovery, and then there's the emotional and the psychological recovery, which are all sort of part of it. Mm-hmm. Many patients get it done and it's a huge change and they're just thrilled right away. But some people are just, it's not, I wouldn't say it's 100%. Some people have an awesome result. You're thrilled as a surgeon and they're just like in shock. They're like kind of not used to it.
Yeah.
And then it can take them a few months to sort of catch up and say, no, I really like it right now. Versus facelifts are not necessarily, they're changing their look, but we're trying to restore their look. It's a different operation for middle-aged patients who are trying to restore. Now we have the other category of facelifts where patients are younger and maybe have facial shape issues and they're doing facelifting to change their appearance as well. But in many of those cases, I find with the aging face or facial reshaping, the patients are usually very, very happy quickly.
Yes.
Whereas the rhinoplasty seem to be a little bit more complicated psychologically on their mental recovery from the operation.
And we said in our other podcast as well that it can take a year. So, and we can go into this for another 3 hours because this is such a mental health with cosmetic surgery is such a big topic. But what advice can you give a patient when they're waiting that year to see how they heal? How do you counsel them through that?
Well, it's hard because what I say and what they listen to may not be totally adopted. But, patients come in and they've taken a million selfies of themselves. And we usually tell them, don't take a million selfies of yourself because the camera is going to capture you in a certain light and it's going to distort and make it look a little bit not necessarily real to life. Don't be staring in the mirror. Don't obsess if possible. Try to focus on other things in your life that make you happy. Don't focus on the surgical outcome. Let that sort of, you've done it. You've been gutsy enough to go through the procedure. Let your body now mend. Just focus on alternative things in your life. And then we're going to be looking at your nose together every few months to see how you're doing. But don't allow it to become a preoccupation that's swirling around your head 24/7, because nothing's healthy to be swirling around your head 24/7, let alone a surgical outcome that's still in its early stage of healing. Yeah. And we've told you up front, may take up to 12 months until we can see the surgical final outcome. So focus on other things. Try to stay healthy, calm. Go to the gym.
Do your follow-ups.
Do your follow-ups. Go to the gym. Just live a healthy life. If there's certain things that are causing you severe anxiety, then try to address them. Sometimes that requires seeing your family doctor and occasionally going on some medication if necessary, because the anxiety can become overwhelming. Yeah. If it's something more subtle and mild, exercise, healthy lifestyle, going for walks, listening to meditation podcasts, or that podcast, that app Calm, I think is useful for patients.
Yes.
All of those things we sort of recommend, and they can prove to be very, very helpful for patients. The other thing that's very important to mention is just family support. So we sometimes find patients are just triggered because someone in their family said something to them, and they'll swirl around, whether it be a spouse, someone you're living with, a parent, and they've sort of not been supportive of the process. So they've gone and had the procedure, things are going through the healing process. And for instance, the mom or dad says, oh, it looks a bit puffier, it looks a bit swollen, or it's not as small as I think you wanted, dear. That can swirl around and trigger an entire cascade. So sometimes I think you've heard me, sometimes we're counseling the parents to lay low and be supportive, because they may not intentionally be trying to trigger something, but just unintentionally may something that especially a younger patient may hang on to, which makes the recovery more challenging.
Yes, yeah. That's beautifully said. I think, sitting with you today, it's super helpful for me in educating a patient. I know that we can do this part 2 another time because it's such a big topic, but I know whoever is watching this right now is going to be extremely helpful for them making a decision, as well as understanding it's not just the physical, but it's also the emotional and mental part of this.
Yeah, no, for sure. I'm glad you brought this topic to our podcast. I think it's a tough topic to really explore because but it's a very important topic to explore and to talk about. I find it even fruitful just to have the conversation with you, to have everyone on the same page. So we sometimes have these staff debriefs and we talk about things like this just so that everyone in the office is aware, sensitized, and able to provide, feedback. Because I'm not always the first point of contact. Sometimes they're calling you guys and saying, hey, I'm stressed out, I'm this and that. And then you guys, have some of the tools available to help the person during the healing and recovery. Yeah. So thanks for bringing it forward today. It was a great topic.
Thank you. Yes, thank you.
And thanks everyone for joining in to UnPhiltered, and we'll see you back soon.